And now I'd like to turn it over to Dr. Aimie Meditz, our infectious disease extraordinaire.
Thank you. So I'm going to take a little different perspective and talk a little more about the COVID pandemic in general. First thing I'm going to start with is I've took a little bit of a step off from some the questions that we have received from everybody in our community. One of them actually I took from the many times I've been asked this question at cocktail parties. So what is an infectious disease doctor? And the second part of that question that refers to this pandemic is how are we helping BCH as it relates to the pandemic? So the first part is infectious disease doctors are doctors that take care of people who are infected with microscopic organisms. These could be bacteria, viruses, parasites, or fungi. These could infect any part of your body, and infection could be very mild to very severe. Everybody's obviously quite familiar with a novel coronavirus called SARS-CoV-2. This is the virus that causes the disease COVID-19. Our main role in dealing with this pandemic is our team is continuing to see patients with all kinds of infections, including individuals with COVID-19. We also work as a part of a team that's already been referred to today, a team of administrators and physicians to ensure the safety of patients and our staff by helping the hospital develop protocols and treatments based on the most current data that's out there. So the next common question that I'm asked is, what can I do? I'm here in the community, how can I keep safe? So I want to start with recognizing the challenges with the shelter-in-place order. It's in our nature as humans to be social. And we are sincerely grateful to our community for abiding by the physical distancing. It worked. Our health care system to date has not been overwhelmed, and this has made a huge difference. I want to explain why physical distancing an entire population was necessary. So first, this was a new infection. Our bodies had never seen it, and we have no immunity. People who are symptomatic as well as asymptomatic or pre-symptomatic can spread this virus. The initial challenges associated with testing and identifying people who were infected also played a role in the problems we initially faced. The final thing is, I'm going to go into a little more depth, is this virus is highly contagious and has had a significant death toll in the United States and worldwide. So although that we have not been overwhelmed at Boulder Community, we're not out of the woods yet. It's important to continue measures of physical separation to limit community spread and unnecessary deaths. If you're a healthy individual and you think, I'm just going to let myself get infected, you should think twice. Anyone could develop severe illness. Yes, people who have multiple medical problems and are older are more at risk. The other thing you should consider is you could potentially infect 3 other people. This has downstream consequences causing severe illness or death in other individuals. These could be your neighbors. These could be your friends. This also has another trickle-down effect that it could, again, come back around and cause our healthcare system to be overwhelmed. Don't get me wrong, I'm advocating caution, not fear. At this point, when you're in public, think of yourself as possibly infected with SARS-CoV-2, even if you feel well. Currently, we want you to stay at home as much as possible, particularly those at highest risk categories. If you need to perform essential activities, like going to your doctor, this would be in that category, or once the Boulder area shelter-in-place expires based on epidemiologic information, we're still recommending certain cautionary measures when you're in public. Continue to maintain the 6-foot distance. We want frequent hand hygiene and avoid touching your face. and we want you to wear a non-medical cloth mask. So I want to go into this non-medical cloth mask a bit more. I want to acknowledge that we all feel awkward, distant, wearing these masks. It feels weird, but wearing a mask is really taking care of yourself, the people you care about, and your community. You should think every time you leave, it's your new accessory. Your cloth mask is going with you. Wear your mask when you're around other people. The function of this cloth mask is to prevent the spread of infection from you. The mask traps the potential viral particles in the droplets that you are breathing, coughing, sneezing. Even if you feel fine, this goes back to that this infection can be spread and you could be infected and you have no symptoms. This is a very popular question in our area, but what do I do when I'm exercising? So I like to exercise. I've given up running, but I still love biking, road biking, and mountain biking. And if I'm biking, I bring my mask or my neck gaiter with me when I go out. If I start nearing people, I put on my mask. If I'm on a more populated trail, I wear my mask constantly. It's too much trouble to go back and forth. So that's kind of how I handle it. It's just my new accessory. I also want to touch on surgical masks and N95s. These are designed for healthcare settings and other high-risk environments. All of our BCH employees and staff are wearing surgical masks at work to provide employees and patients optimal protection. So the other topic that's been very popular is testing. Testing has been in the news, and you can probably have seen in the news things are getting scaled up. I want to talk about the different types of testing so that hopefully to provide some more clarity about what the testing does and what's out there. So there's this swab testing. So the swab testing involves putting a swab into the back of your nose where your nose meets your throat. This is where the virus lives. This tests the genetic material of the virus, which is called RNA. And this identifies people who are actively infected. So they're actually currently infected with SARS-CoV-2. This access to this testing, you're going to see significant increases in our community. For people who are sick, they're going to have increased access. This will help us identify people who are infected, isolate those people, and identify people who have had close contact with them. The other thing that's been in the news is a type of testing that's the blood testing. So this could be anything from a finger prick to somebody drawing a tube of blood from your vein. This measures antibodies. So antibodies are a part of your immune system that develops a response to an infection, and in general can provide protection from future infections. This is the basis for vaccines. So we have a test at BCH that identifies these antibodies to SARS-CoV-2, the virus that causes COVID-19. The test that we have at our institution tests people who have had past infection. There's a lot of information about people who have inaccurate tests out there. This is going to be intrinsic. These tests were brought to market quicker due to the allowances of the FDA. And so what we did at BCH is tried to pick the test with the best performance. So what do you use this test for? So this test has been used in the past for epidemiologic purposes. So you study a group like the county of Boulder, you could test that and determine what the frequency of testing would be of positivity, antibody positivity in that area. And that just helps them make decisions about how many people did get infected, particularly in this instance where certain testing methodologies were not available. In fact, here at BCH, we have a project in which we're testing a subset of our employees thanks to a grant from the BCH Foundation. But this test is also of interest because people are just curious by which if they were infected. But I want it, which is fine. People can order this test, your provider can order this test, but we're not making any decisions about whether somebody can work or if there's certain community activities based on this testing as of yet. We do have some hints from other coronaviruses that antibodies could provide some protection from recurrent infection, but we really don't have any data for this current virus, SARS-CoV-2. So that said, it's critical to maintain the physical distancing, masking, hand hygiene, even if you're known to have had this infection, by either testing methodology, just because we don't know for sure that you're going to have immunity. So people ask me, what is it like to take care of individuals who have COVID-19? So really, when I thought about this question and I closed my eyes, I really thought about the people around me and the staff that I work with. And I think of the amazing ingenuity that I've seen, the collaboration, the general willingness to take care of all of our patients that's come from nursing assistants, providers, respiratory therapy, laboratory, environmental services, food service, and spiritual teams. This has certainly been echoed by all of us, but that's really what is one of the first things that comes to mind. People have asked me whether I am scared to take care of these patients. And really, I feel a sense of respect. I have a process that I go through, which is putting on the protective gear that we have available here at BCH. We have that luxury of having that protective gear that's going to protect us from this infection. And the other point I want to make is that my experience taking care of patients here at BCH is very different than many other areas of the world, of the United States, because we're not overwhelmed here. I'm able to use many of the same processes that I normally go through to take care of patients. I just have to go through putting on my PPE, or my personal protective equipment. The other thing that's a bit different is when I do go in to see patients, there's no family members. Just because that's a safety issue, we don't allow visitors. So you're acclimated to having family members when you see a patient, but I would go through the same things, kind of progress plans with that patient. Many times we're getting the family members on FaceTime, so we can kind of have that interactive feeling. So, and then I would leave the room, and we often have an assistant that's helping you talk through removing your personal protective equipment. It's the most important steps for our safety when we take care of these patients. So that's kind of the end of what I had to talk about today, and I appreciate your time.